The way we use language in social situations, known as pragmatics, can differ from person to person based on an individual's specific needs. For individuals with an acquired brain injury, impairments they experience can directly impact their ability to navigate social media effectively. This video will discuss some common social communication challenges that are associated with ABI. ABI can often lead to challenges in social communication skills, such as difficulty recognizing and understanding social cues, misinterpreting abstract concepts like sarcasm and humor, having trouble with implied meanings or reading between the lines, and losing track of conversation points. Individuals with acquired brain injuries may face challenges in comprehending and interpreting language, which can affect their receptive language skills. They may also struggle to express their needs, thoughts, or ideas, impacting their expressive language abilities. Receptive language difficulties, which refers to ability to understand, can impact expressive language and vice versa. When individuals have difficulty understanding what they hear or see, it affects their ability to respond or express themselves effectively. If they are unable to communicate their needs clearly, they may not receive the appropriate information or response, leading to miscommunication. Difficulties in receptive and expressive language can have various consequences, resulting in issues related to interpreting nonverbal or gestural cues in body language such as facial expressions, head position, hand movements, or eye contact. There can also be difficulty in interpreting verbal cues such as tone or volume of the speaker's voice and natural pauses when speaking. Self-regulation, such as understanding or regulating one's emotion, for example, how you feel about the information, behavior, such as how you react to the information, and attention, including keeping track of the topic and not interrupting, can also pose as a difficulty. Difficulties in managing the flow of information can lead to issues with knowing when to interject with your thoughts or information. Turn-taking or knowing when to start or stop within the conversation is important to holding a speaker's attention or showing your interest in the conversation. There can also be issues related to tangential speech, which is related to off-topic interjections, meandering away from the topic, also labeled as going off on a tangent. People with ABI can struggle with topic maintenance, adding details that communication partners may interpret as irrelevant. Sometimes they are related to the topic or related to a shift in attention for the ABI survivor, but they may have difficulty linking their thoughts in a way that makes it clear to their partners, seemingly providing random or irrelevant information, leaving others not knowing how to respond. When we communicate with others, we typically modify our language based on various factors, such as the type of communication we're engaged in, whether it's a conversation, giving directions, or issuing a command. Our language usage adapts to the speaker and the specific situation. We learn to speak softly in a library and loudly at a concert, and we interact differently with close family members compared to school principals or police officers. We adjust our language based on the nature of the conversation, the person we're speaking to, and the environment we're in. However, individuals who have experienced an ABI may encounter cognitive communication impairments that make it difficult to adapt to these communication demands. Some common effects include executive functioning. These difficulties can cause issues with managing the flow of information into and out of the brain. Difficulties with executive function can appear as difficulties with filter, saying things seemingly without thinking, difficulty predicting consequences or outcomes, managing turn-taking, or shifting between topics, conversation partners, and ideas. The decision on how to respond to information or how to use the information may be difficult to comprehend, leading to poor decision-making. Planning and organizing thoughts and ideas can be associated with ABI. Difficulty relaying information in a relevant or productive manner to others impacts effective communication with others, especially when seeking information such as joining personal interest groups, explaining tasks or events, or carrying on conversations with others. Others expect relevant information to be included in the current discussion. Thoughts can be tangential, appear rambling, or out of context. There can also be effects associated with memory. This includes difficulty recalling and holding information when speaking with others. This can lead individuals with an ABI to interrupt conversations to ensure they share their information before forgetting, or to repeat stories, jokes, or facts they may have shared previously. Individuals with ABI may need repetition or a summary of conversations to aid their memory. It can also affect attention and concentration, where engaging in active listening can be difficult as the individual may be unable to focus on the information presented. Issues often increase with external distractions such as environmental noise, added or competing visual information such as presentation slides and multiple speakers. Internal distractions may also interfere with attention skills, including pain symptoms, physical limitations, for example, sitting for longer periods, fidgeting, neurological tremors, and more, sensitivities such as noise or light, and physical or cognitive fatigue levels. Impulsivity may manifest as not following the social cues during conversation, speaking out of turn, or not awaiting the speaker to finish. One may interject prior to processing information presented, not fully understanding or not allowing the speaker to complete their thought. Impaired cognitive abilities can lead to frustration and potential increases in anxiety, behavioral expression, impulse control, or disinhibited behavior. One may experience a verbal outburst, cognitive fog, inability to focus, loss of attention, disinterest in the conversation, negative feelings about socializing leading to a loss of interest in connecting with others. One may experience an outburst, unexpected or inappropriate response to information presented, such as speaking before you think. They can experience feelings either from external sources, including other speakers' comments, misinterpretation of body language, disagreement with the speaker, or one speaker dominating the conversation. Internal sources also affect a person's responses, including pain, fatigue, anxiety, misinterpreting information, or feeling overwhelmed. As the brain works harder to process, interpret, and respond to information, our body and mind experience the onset of fatigue and cognitive decline, increasing the chance of disinhibited behavior. Speech-language impairment can include challenges with the speech production system, such as issues with articulation, voice, oral motor movements for speech, and muscle control. Language systems can also be affected and impact word finding, reading comprehension, vocabulary, morphology, etc. Speech, language, or cognitive communication impairments can be deeper rooted with underlying challenges such as difficulties that attention, processing speed, memory, and more can have on tasks such as reading comprehension. The way we use language and social pragmatics plays a crucial role in communication, allowing us to adapt our language based on the speaker, situation, and environment. However, individuals who have experienced an ABI may face difficulties in both understanding and expressing language. These difficulties can hinder their ability to interpret nonverbal cues, follow conversations, regulate their own behavior, and convey relevant information. Cognitive communication impairments can also impact executive functioning, such as planning and organizing thoughts, memory, attention, impulsivity, disinhibited behavior, and speech-language abilities. It is important to recognize these challenges and collaborate with healthcare professionals, such as a speech-language pathologist, to develop effective communication strategies that can help individuals overcome these obstacles. By doing so, they can enhance their social interactions and improve their ability to communicate with others.